And the topic that we'll be treating or that we'll be looking at in this module is mental illness. This is the third video for this course. In our previous modules, we've introduced ourselves to mental health management. That was the module 1, Introduction to Mental Health Management. And then the series of mental health management for our second module. So we believe these two topics have been well justified. So now let's move on to the next topic in module 3, which is mental illness. In this module, we have the contents of the module we'll be looking at the meaning of mental illness, the symptoms of mental illness, the factors of mental illness, prevention of mental illness, and the types of mental illness. We'll also move on to look at the treatment and medication, then treatment team and medication. And let's introduce ourselves to the module, to the title, mental illness. So when we're talking about mental illness, what does it mean? It actually refers to a broad spectrum of conditions that impact an individual's emotional, psychological, and social well-being, shaping their thoughts, feelings, and interaction with others. So we can easily say that mental illness refers to some kind of conditions that is related to health, which in one way or the other impacts a person's emotional, psychological, and social well-being by shaping their thoughts, their feelings, and interactions with them with other people. So let's put it that with other people. So this condition, when we are talking about mental illness, it includes anxiety disorders, depressive disorders, psychotic disorders, and also personality disorders, each with distinct symptoms, causes, and effects on daily life. All these conditions, they have their symptoms and what caused them and the effects on daily life differently. That is quite different from one another. That is to tell you that the symptoms of anxiety disorder is quite different from that of depressive disorder. So with millions affected worldwide, mental illness like anxiety and depression, they are the major contributors to disability, and emphasizing the need for awareness, understanding, and effective management. So now let's move on to the meaning of mental illness. We can't just talk about mental illness as our topic without defining or doing justice to the meaning of a mental illness. It refers to a person. It refers to a person's mental, emotional, psychological, and social well-being. That's mental health. It also affects how individuals think, feel, and act, and influences how they handle stress, relate to others, and make choices. So good mental health is more than just the absence of mental disorder. It also involves realizing one's potential, coping with normal life stresses, working productively, and contribute to the community. So let's look at the symptoms of mental illness now. The symptoms of mental illness, it can vary widely depending on the specific condition, but there are some common signs which include persistent sadness or low mood. It also includes excessive fears or worries, extreme mood changes, withdrawal from friends and activities, significant tiredness or low energy, detachment from reality, such as we could have it in delusions or hallucinations. So it also involves inability to cope with daily problems or stress, confused thinking or reduced ability to concentrate, and changes in eating or sleeping habits. These are the symptoms that we can actually see or experience or witness that we introduce us to let us know that this person is passing through so or some kind of mental illness. So these symptoms are very common to people that do not have good mental health. So now let's look at the physical symptoms that and these physical symptoms we have. It's like unexplained aches. There are sometimes we just feel some kind of pain that we cannot actually explain deeply. This might also occur, and in several cases, thoughts of suicide or self-harm can emerge. So when this pain gets severe or gets more worsened, different thoughts can erupt and come to mind or emerge. So it's very important to note that experiencing some of this occasionally does not necessarily indicate a mental illness, but when it is persistent or severe symptoms, it's then we should know that there is it warrants professional evaluation or professional consultation. Sorry. And the next subtopic that we'll be looking at is the factors of mental illness. Mental illness often arise from a complex interplay of factors rather than a single cause. So when we're talking about these complex interplay of factors, these include: one, we have biological factors. Under that, we have that sometimes genetics and family history could play a major role, in the sense that some certain genes can increase susceptibility. Brain chemistry imbalances such as neurotransmitters and prenatal exposure to viruses or toxins are also contributors. Another factors of mental illness that we have here is environmental factors. This has to do with adverse childhood experiences like trauma, abuse, or neglect. All these are we can actually relate or have someone that has actually happened to in an environment, if we calmly look very well. So ongoing stress from poverty, we talk about financial hardship in our previous module, that it can also cause a lot when we are talking about mental health or mental illness. Discrimination can also lead to is one of the factors too, or violence. And finally, exposure to environmental hazards can heighten the risk of mental illness. So let's move on to the next factor, which is the psychological factors, where we have in cases where we have low self-esteem, chronic stress, or negative thought patterns can also contribute immensely to mental illness psychologically. Then we have the last one, which is the social and lifestyle factors. And in this, we have the abuse of substances, sometimes abuse of substance abuse, social isolation, major life changes, e.g. loss of loved ones, and unhealthy habits like poor diet or lack of exercise may also factor in. Risk factors can accumulate, and not everyone with this will develop a mental illness. So we move on to the next subtopic, which is prevention of mental illness. How can we prevent mental illness? Well, at least we've been able to introduce ourselves to the factors of mental illness that aid mental illness, that even promotes mental illness. So if we know the factors, which could be, we can say, to be the causes, now the next question should be that how can we prevent this? So which will lead us to this subtopic where we have prevention of mental illness. So in order to prevent mental illness, preventing mental illness involves promoting mental well-being. That is, before you can prevent mental illness, you should definitely, you have to promote your mental well-being, and also addressing risk factors early. The strategies in which we can prevent mental illness include the following. We have: one, building strong social connections and support networks to reduce isolation. We should try and strive as much as possible not to avoid being isolated or being solitude. So building strong social connection, try to be social with people that are of your standard and of your level, that can easily match the energy. So we have the second one to be maintaining a healthy lifestyle with regular physical activity, balanced nutrition, adequate sleep, and avoiding substance abuse also. Moving on to the third one, that is the third ways in which we can prevent mental illness, is to manage stress through mindfulness, relaxation techniques, or hobbies. We should try to manage our engaging in unnecessary stuff and manage stresses through mindfulness by taking proper rest and relaxing, and engaging in different hobbies that we kind of like. So now we have the next one to be seeking early intervention for emotional issues such as thorough counseling or community programs. And the last one is to promote protective factors like education, stable employment, try to be busy enough, and safe environments at community and societal levels. And now we move on to the types of mental illness. We can't just talk about mental illness without looking at different types of mental illness that we can actually mention. So in generally, we have there are over 200 recognized types of mental disorders, categorized broadly, but the common ones include the following. We have one to be mood disorders, we have anxiety disorders, we have psychotic disorders, we have trauma and stress related disorders, then we have obsessive compulsive and related disorders. These are the most commonly or generally known ones. Let's start from mood disorder now. As under mood disorders, we have that such as major depressive disorder and bipolar disorder, between mania and depression. So this is persistent to sadness and loss of interest. Mood disorder has to do with being persistent to sadness and loss of interest in almost everything. So that's his mood disorder. We also have anxiety disorder, and this one, it includes generalized anxiety disorder, that is excessive worry, panic disorder, which is sudden panic attacks, and social anxiety disorder. This in a nutshell, anxiety disorder it is generalized. It involves all the general types of anxiety disorder, which could be excessive worry, it could be sudden panic order, it could be social anxiety order and disorder and the likes. So moving on to the third one, which is the psychotic disorder. This is like schizophrenia. It has to do with hallucinations, delusions, and disorganized thinking or imagining things in a disorganized manner. And the fourth one is trauma and stress related disorder. This as we can easily the common one under this is PTSD, that's post traumatic stress disorder, which occurs from traumatic events. Then the last one is obsessive compulsive and related disorder. This one, it includes OCD, that's obsessive thoughts and compulsive behaviors. So moving on to the treatment and medication. How can we treat mental illness, and what are those medication, the kind of medication that we need to use? So treatment for mental illness is it is tailored to the individual and often combines approaches. So your the treatment strictly depends on the type and severity of your mental illness and the method that is best for the sick person, the mental ill person. In many cases, combination therapy is best. That is where we have therapy. Combination therapy is best, where people come together to express what they are passing through to a therapy. If you have in mind mental health and your symptoms are well controlled, your primary care providers treatments may be sufficient. However, the team approach is usually applied in order to ensure that all mental medical and social needs are actually met. This is especially important for serious mental illness such as schizophrenia. Now, let's look at who are the treatment team. Who are those set of people or group of people or teams that actually can treat mental illness? So let's take it one after the other. Your treatment team may include the following. It's not even me, the following. So we have one, you, that is the person that is mentally ill is actually the number one on the treatment team that can actually this actually means that your illness or your healthiness is left to you. It is a you versus you. So now we have you, the person involved, and two, we have primary care or family doctor. That is, after that, we have family doctor. They can also treat. We have practicing nurse, and we have physician assistants. There is also psychiatrist. That is a doctor who diagnoses and treats mental illness. Then we have psychotherapists too, where we have psychotherapy such as a psychologist or licensed some consultants. We have pharmacists, we have a social worker, then we have family members. These are treatment teams. So medication, let's move to medication now. When we're talking about medication, although psychotropic drugs cannot cure mental illness, but they can improve symptoms significantly. Psychiatric drugs can also help other treatments, such as psychotherapy. They can also help these drugs treatment to be more effective. And the best medicine depends on the specific situation that body responds to the medicine. Some of the most commonly used psychiatric prescription drugs categories include the following. We have antidepressants and mood stabilizing drugs. Antidepressants are used to treat depressions, just like the name implies. And we have mood stabilizing drugs. They are also called mood stabilizers. They are often used to treat bipolar disorder, in which mania and depression occur alternately. So in conclusion, we can actually say that we've been able to justify our mental illness for this module, under this module. So in conclusion, mental illness we can be said to affect millions worldwide. It also impacts emotional, psychological, and social well-being. And social well-being. So by understanding these complexities of mental illness, and also reducing stigma, promoting early intervention, and ensuring access to support, we can actually create a more supportive environment that encourages individuals to seek help and promote mental well-being.